Senator Cash, what purpose do you rise?
See if the senator would yield for
For questions? Yes.
Senator yields.
Senator yields.
Senator, did you know I served on the subcommittee and in full committee, and that I've read the bill at least a half a dozen times in its various versions. I'm reading it again, and I would say that it is like digesting an elephant. I mean, it's just very complex. Did you know? Would you agree with that?
It is. I mean, we're dealing with a subject matter that we have not dealt with before, and it involves a whole host of public policy considerations that we haven't dealt with before. And by its nature, since it involves medical science, it's going to be complicated by that level as well. And then you factor into all of that the alleged societal consequences of it. You've kind of made yourself the ultimate law school question.
Right. And did you know, Senator, as I mentioned to you earlier in the day, you know, that I could take several approaches to determining my vote on this. One would be just to look at the big picture and say, well, I want to help Ms. Richardson, so I'm going to vote yes. Or I think this is going to harm law and order, and I'm going to vote no. And there's big picture considerations here, and I'm not downplaying that at all. But also, I'm a very process-oriented person, Senator, and did you know that this bill, 55 pages of it, is laying out an enormous framework for everything from what conditions can allow someone to access this to how does that affect companies and the way they deal with employees. It's enormous. And so from that point of view, Senator, I don't see any way to arrive at a informed decision on my part, whether anybody else feels like this or not, without taking this bill apart section by section and question by question, because at the end of the day, for me anyway, understanding the trees is going to inform my view of the picture I'm looking at. Did you know?
And you made that point earlier, Senator from Anderson, that understanding the trees will help you assess the forest. And I'm perfectly willing, as a way of going about this, as we go through the bill and as I get to a section and as I kind of give the reasons how we arrived at it, dissecting it, taking apart, questioning, challenging as I go along with it. It's not my intention to predominate on the floor up here, but I do think you're right. It's important for each member to fully understand each tree in order to determine how they're going to vote on the forest. And I don't disagree with anything that you're saying. I wish there was another way to go about it, but you just nailed hit the nail on the head in terms of, on the one hand, if you just did this from a 40,000-foot view, it's a matter of, do you give Margaret Richardson medicine, or do you listen to law enforcement and say, no, this is going to make our job much harder? What you're saying is you need to get down into the specifics in order to make that assessment.
That's right. And Senator, perhaps next week when we get started, I'm going to try to get you from the very beginning and just go through this thing page by page, because that's what I've done a half a dozen times, and I'm making notes. And did you know, Senator, I don't consider myself a hostile questioner, not that I say anybody else is, but I can't get the answers without asking the person who wrote the bill, and that's you.
Of course.
And that's going to be important to me. So we're already 2 pages into the bill, and I'm not going to try to cover much today, but I do want to just say that, did you know that after the passage of this bill, a committee will determine additional conditions which would allow someone to access medical marijuana, but at the beginning, today, right now, we are the committee that is approving the original conditions under which a physician may fill out a certificate. And so, did you know that, and I think you've taken this seriously, that and this may be someone's argument against this bill, I mean, we are in that sense providing kind of a right to try approach to people. Did you know that in the committee meetings that we distributed a list from the National Academy of Sciences and so forth, and I got a list from both those who were favorable and those who were opposed to the bill, and both lists agreed on the conditions upon which there is empirical evidence from this National Academy of Sciences, Engineering, and Medicine, which is referenced in your bill at the very beginning. And what I just want to briefly point out to you, perhaps we can get a copy of this to the various member, is that there are some conditions that these studies which are referenced say there is conclusive or substantial evidence that medical marijuana is effective in treating these conditions, correct?
You're referring to the National Academy of Sciences, and that was published in 2017. And the point I was making yesterday, can make further, is that there are hundreds of other peer-reviewed studies as well. And what I've attempted to do is narrow the universe of qualifying conditions down to those things for which I think there is substantial medical authority. Your point is some may differ, some other studies may differ, and that's true. But the reason I take some comfort in all of this is, at the end of the day, it's that physician in consultation with that patient that decides what's in that patient's best interest. It doesn't matter what, really, I mean, it matters because it's evidentiary, but it's secondary to that in-person diagnosis that a physician makes. So what the National Academy of Sciences said, or the Multiple Sclerosis Society, or the Academy of Physicians, or whatever they might be, that's great for us to have as policymakers, and we ought to talk about that. But we should never lose sight of the fact that the most important conversation is going to be between that physician and that patient, based on that patient's condition and history, and that physician exercising his or her skill. I mean, to me, if I was to say what is the foundation of this bill, it is that. This entire bill has been drafted, at least I've intended to be drafted, to be physician-centric, that it's centered on that. They're the ones that have the authority to authorize its use. They're the ones that have the authority to say no. And I personally think that's what that ought to be. It ought to be not at the state level. At some extent it's going to be, because we have qualifying conditions we outline, because we make laws. But that is going to be secondary ultimately in importance to what does that physician and that patient decides in that patient's best interest.
Okay. Well, that clarifies your thinking somewhat for me. Because since we are determining the original conditions, you would almost have to footnote this extensively to say, and the reason Crohn's disease is on here is because we have these 3 peer-reviewed studies that indicates that medical marijuana is either very effective, somewhat effective, et cetera. So,
but ultimately, irrespective of how many studies you want to line up on one side or studies on the other, there is evidence. If there is evidence it could be of medicinal benefit, why would you not want to empower a physician to authorize the patient's use of that if, in that physician's opinion, after diagnosis, think it's in that patient's best interest? I guess that's the way I would phrase that issue is, I want to empower doctors, okay? I want the doctors to be sovereign there with the patient. And we have to, as lawmakers, kind of define a universe, because that's what we do, okay? But the universe that I've defined here, it doesn't mean that for every patient that has PTSD, or every patient that has epilepsy or cancer, or whatever this thing, it doesn't say that, yes, cannabis can help you. All that is a definition of what authority, what empowerment we're giving to physicians, and the physician ultimately is going to be the one that makes that determination. So I think that's an important point here, is that we're not, by passing this law, saying that patients that have these 13 qualifying conditions can automatically benefit from medical cannabis. That's not it at all. That's just the beginning of the inquiry. This is the scope of the authority we're giving to a physician. It's that physician in that examination room that's making that determination. And ultimately, I think that's where I have the most comfort. That's where I want the power pushed down to. I want to push down there.
I understand your explanation. I do think it is a pretty important point that maybe I haven't picked up on in committee or subcommittee, because we heard a lot of testimony about this condition or that condition could be helped. But it sounds like what you're saying is that regardless of whether that condition's on here, and even almost regardless of whether the committee was to add it later on, because there's going to be a committee that's going to meet a minimum twice per year to consider additional conditions, which would allow the physician should be aware of when examining a patient. But it almost sounds like you're saying that in addition to all of that, it's really up to the doctor, that it's including all of these things, but not limited to these things, that if the doctor feels like medical marijuana could help you, then he has that latitude to fill out a certificate accordingly. Am I stating that accurately?
Tom Davis's view is that the state ought not interfere with that physician-patient relationship. This bill, however, does circumscribe that relationship by saying a physician can only authorize its use for certain medical conditions. So the statement I was making was in terms of, philosophically, I see this bill as one that empowers physicians, because I think that's the very first public policy argument we ought to be advancing when it talks about health care. Okay? But to your point, this bill does not give a physician unbridled discretion. This does not give them the ability to go outside of those 13 qualifying conditions. They are constrained in that regard. It is that way because people are concerned about it being abused. They're concerned that it's a brand new program and that we ought to go slow, that we ought to take a cautious first step. I respect all that. I'm practical and pragmatic about this. I want to pass something that's going to help people, okay, that actually gets passed into law. And so what my personal preferences might be are secondary to what does this body want to do? And maybe I've inferred the wrong things, but I think what this body wants to do, reflecting what their citizens want, constituencies want, is something that at this stage is narrow, is regulated, is conservative, so that we have the ability to observe and to see what the effects have been. That was my reason for coming up with 13 qualifying conditions, not because I think the state ought to be interfering with what a physician thinks is in a patient's best interest and that patient concurrence, but because as a reality and in terms of and recognition of the fact that this is something brand new, that the appetite was going to be to go slow. That's the reason for that.
I understand, and I'm going to say a few more things, not to belabor the point, but it's an important point.
It is an important point.
We are standing, as it were, in the place of the FDA with these 13 initial conditions. Now, this document I have that is from 2017, admittedly.
National Academy?
Yeah. So when I look at this document, I can kind of rate these conditions based on whether there's conclusive evidence, moderate evidence, limited evidence, or no or insufficient evidence, because that's the way they're presented. And both the doctors who were for and the doctors who spoke against medical marijuana referenced the same sheet. So they all seem to agree that what's on this piece of paper is an accurate reflection of what was in the National Academy of Sciences studies.
That was based, and you're right, that was based in 2017 upon a review of 10,000 different scientific abstracts, and then they broke it down into those evidentiary categories.
Which is a large number, 10,000 abstracts. This is what they concluded. But the 13 conditions that you've got listed here aren't found on this document. Crohn's disease is not on here.
But they are found in other periodical peer-reviewed studies.
I understand, Senator, and I guess the point I'm making is I can trace this to the bill. Unless you're going to provide the documentation of why you have included Crohn's disease, then I and all the rest of us are just going to take your word for it that there is peer-reviewed evidence that these 13 afflictions, at least these 13, could benefit from medical marijuana. Now,
Let me wait for a second. I don't want you to take my word for it.
Well,
I'm going to give you the site to the study right now so that you can look at it over the weekend if you'd like me to.
I don't want them right now.
Okay.
But
to answer your question
I
directly,
think you have the sites. I'm not doubting that.
I'll provide them.
But that is in fact what we're doing. We're setting out the initial conditions with the understanding that a committee later on, based upon evidence, including public hearings, can add conditions to that list. But initially, we are the doctors, because that committee is going to be made up of 11 people. Initially, we're standing in the place of that committee and saying, for these 13, we give the green light. And then after that, it's kind of going to fall in their lap to say, well, hey, there's new studies, and we should add this condition. Or they may say, I guess it's potential, they could say, there are so many studies now that show that there's insufficient evidence, perhaps we should remove a condition. I don't know if that would ever happen. I'm just, kind of thinking randomly.
Yeah.
But that's going to be their job. And so, did you know, Senator, it does give me comfort if I end up voting for this bill that when people ask me, I'll be able to tell them a lot of things because I'm very informed of the bill. But I will be able to say, well, these 10,000 abstracts provide conclusive evidence, or they provide moderate evidence for these conditions that we put in this bill. And so I'm positive you have the footnotes.
Yeah, but your point's well taken. I mean, you need to have a justification for whatever decision you make. And I respect that, and I'll provide you with those studies.
Thank you.
Yes, sir.